Good morning. Sun shining on downtown Winnipeg. Thanks for starting your day with us. Well, at one point in time, it probably seemed like a good idea. Well, maybe now that tattoo has you cringing. Dr. Earl Minuk joining us this morning with a look at tattoo removal, which is becoming increasingly more popular.
Well, not only has putting tattoos becoming more popular, putting them on, but taking them off is becoming even more popular.
Yeah, I can imagine.
Well, we've been doing it for 20 years now, and we've done thousands of people. And although it's not in some cases, it's not absolute, but fading and removal is a very, very hot topic today.
Okay, well, we actually have video of a procedure that actually took place. So walk us through exactly what's happening and how this laser is working.
Well, this is a laser called our ruby laser. We have two lasers, and you can see it's about what we call a 5mm spot size. And my technician is zapping that tattoo. Now it's what we call a tattoo on the lower back, or some people call it a tramp stamp. And we're getting a lot of those. Those are really out of vogue today, Courtney, and people are trying to get rid of them. And you can see that little white ghosting or white color discoloration. That will fade out. So Donna here is, under our supervision and training, is treating this tattoo completely.
Okay, so how many treatments can you expect it to take?
Well, you know, that's difficult to say. I think the average amateur tattoo like this is an amateur tattoo, would probably take anywhere from, I would say, 3 to 8 treatments. It's really hard to say. When you get decorative tattoos, which can be very vibrant, lots of colors, you could be in the office, you know, every 4 to 6 weeks for, you know, for 6, 8, 10 treatments sometimes.
Okay, and it is a little painful. It
is uncomfortable. We sort of give it describe it as hot oil off the frying pan. It has that sort of sparkle feeling to it. Now we have two lasers. This is the ruby laser, so it has like a burst of energy, where the other laser is the YAG laser. It has that bacon-like off the frying pan, like zap, 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 zap against the skin. It can be uncomfortable. Okay. It depends on the area too. Some areas are more uncomfortable than the others. Most people are fine, but what we offer is actually a topical freezing or needle injection if you're very uncomfortable.
Okay, so we have a few before and after pictures just to give you an idea, because black is actually one of the easiest ones to go away. Black is
the easiest now, and the India ink comes off the best. Both our lasers take that off. You can see this is a professionally done decorative tattoo, mostly black, but sometimes the tattoo artist makes the colors more vibrant and putting in a little extra ingredients. Now this is an interesting one. This is a Rolling Stone. The Stones were in the not in the office, by which they were, but the Stones were in Winnipeg years ago, and you see an influx of tattoos come right after the after the show. Sort of like that commercial. The gentleman has his front of his chest pierced, and his back has got his huge tattoo behind him, and that's what you see. And you can see now we get a lot of these. A lot of older gentlemen have tattoos, and women on their arms. These come off very nicely. It's, you know, this is probably about 4 to 5 treatments. What is very interesting is that I get patients come back to me years later, and we dig up their old pictures. I don't think they have it here, but I submitted a picture for you guys to show. It's a lady who had it went on her breast, and I hadn't seen her in about 8 years, and it was completely gone. And so we snapped a picture of it, so we have the before and after of that. It's a nice procedure. It can be costly for some people, the very large tattoos. I think the average cost is going to run around $200 per treatment. We're a medical facility, so we offer, you know, ongoing care, because sometimes there can be a bit of a wound after the treatment. So we're very careful to make sure that people fully understand what they're getting into, how to take care of it, and give them a clean, nice result.
One of the colors that's the hardest to take off is yellow?
Yellows and purples are probably the hardest color. The reason we have two lasers is because they operate in different spectrums. The ruby laser is very good for the green spectrum and black, and the YAG laser is good for the red and the black as well.
Well, there are options out there if you're not loving that ink so much anymore. I'm sure you guys have heard lots of interesting stories, seen lots of interesting things.
We've seen it all over the 20 years. We have, Courtney.
I can imagine. We'll put the links up for Dr. Earl Minuk on breakfasttelevision.ca. Right now we'll check in with Jenna.